Hi, so we're going to talk about the nucleuses of the hypothalamus. And first of all, we're going to directly look into the lateral nuclei of the thalamus. And if you want to look at the lateral nuclei of the thalamus, it is, if you're looking at the medial view, obviously you cannot see the lateral nuclei. So we will there is a lateral nuclei, obviously, in the lateral wall. So if I have to draw it, it would be around here somewhere, the lateral nuclei of the thalamus. Now, this lateral nuclei of the thalamus is doing what? Lateral nucleus of the thalamus, it releases a hormone called as ghrelin. It releases a hormone called as ghrelin, and this hormone ghrelin is the one that is very important to stimulate appetite. So, lateral nucleus is definitely associated with appetite. Okay, so if there is damage to the lateral nuclei, if there's damage to the lateral nuclei, your appetite is gone and you become lean. So lateral nucleus is stimulating your appetite. Then look at the ventromedial nucleus. Ventromedial nucleus is the blue nucleus that we can see out here. The ventromedial nucleus is very close to the lateral nucleus, right opposite to the lateral nucleus. And because it's right opposite to the lateral nucleus, you need to think about it in terms of having an opposite function to the lateral nucleus, which is basically inhibiting the appetite. Or what I can say is that it actually causes something called as satiety. All right, it causes satiety, and if there is damage again out here, you will have hyperphagia. That is, if this is damaged, you will have hyperphagia. But if the lateral nucleus is damaged, you will have starvation. Is that understood? That is pretty much simple. All right, let's go to the next nuclei. All right, we have there is something called as the anterior nucleus as well, and the anterior nucleus lies anteriorly, so it would be somewhere out here as the anterior nucleus. And the anterior nucleus, I remember as it being anterior nucleus, and anterior nucleus, as I remember, is AC, air conditioner. So it's actually associated with the cooling effect. Correct, it's associated with the cooling effect. Whereas out here we have the posterior hypothalamic nuclei. Let me change the color. The purple one is the posterior hypothalamic nuclei, and the posterior hypothalamic nuclei is again right opposite compared to the anterior thalamic nuclei, right? So the anterior nucleus and the posterior nucleus, they have opposite functions. So posterior hypothalamic nucleus is something associated with heating up, simulates heating. And if you remember, heating is a mechanism of the sympathetic nervous system. So therefore, posterior hypothalamic nucleus is associated with the heating, and that is of the sympathetic nervous system. Whereas the anterior nucleus is associated with cooling, and that is why it's going to stimulate the the parasympathetic nervous system. All right, after that we look into the suprachiasmatic nuclei. Suprachiasmatic nuclei, if you can identify, it is the pink nuclei at the bottom out here. Well, this is the suprachiasmatic nuclei that we have, and the suprachiasmatic nuclei is literally around the chiasma. This is the chiasmal area that I am actually going to make a cross with in black. This is the chiasmal area. So it's above the above the chiasma, so it's called the suprachiasmatic nucleus. Now, suprachiasmatic nucleus is associated with the release of certain hormones that actually maintain the circadian rhythm, something like a melatonin. All right, so it stimulates the release of melatonin as well. It's associated with the release of melatonin and maintains the circadian rhythm. Well, it does not actually release it, but it stimulates the release and it maintains the circadian rhythm. All right, then we have two important nuclei that are situated around, and I'm going to show you with the blue color. This is the supraoptic nuclei, the orange one, and then we have the green nuclei, which is pretty much massive, which is the paraventricular nuclei. Okay, these two nuclei are associated with a very important function. Why? Because their fibers actually are the one, so their fibers go around out here and they land into the pituitary, to be precise, the posterior pituitary or the neurohypophysis. All right, and it lands into the posterior pituitary, and what it does is that it releases it causes release of ADH and also another hormone called oxytocin. Okay, so it causes the release of ADH and oxytocin. So ADH, obviously we know vasopressin, and oxytocin as the hormone that increases uterine contraction and stimulates milk ejection, and ADH is the hormone that causes reabsorption of water in the collecting tubules, right? So ADH and oxytocin. So that is the function of the other two nuclei. And finally, we come into the preoptic nucleus. The preoptic nucleus is the massive red color nucleus that we have out here. The massive red color nucleus, the preoptic nucleus. And the function of preoptic nucleus is a wide function. So I like to remember it to be as one of the preoptics. So it's so it's supposed to be with primitive function. So primitive function would be actually thermoregulation, something like a sexual behavior, and also release of GnRH. So it is associated with release of GnRH. So if the preoptic nucleus is for some reason damaged, so obviously you will have loss of thermoregulation, your sexual drive will be lowered, and your GnRH is also lowered. And this is nothing but Kalman syndrome. Kalman syndrome is something called as hypogonadism. And loss of smell as well is also seen. So the reason why there's hypogonadism is because there's failure of maturity of the gonads, and the chromosomal stata of the patient can be 46XX or 46XY. It does not really matter. All right, so these are the nucleus of the hypothalamus. All right, so I guess we've covered all of them. That the necessary one, obviously the mammillary body and the dorsomedial nuclei are the two that have not been covered. Dorsomedial nucleus is not very important, but the mammillary body is certainly important. The mammillary body we will see as a form of another circuit in another video. All right, thank you very much.